Hello guys, this is Kay from Pod Rainbow Science, and in today's episode I'm going to talk about conversion therapies. Let's start! Hello guys, once again, and sorry for my voice today, but I feel a little under the weather, and this is kind of my end of summer habit. So every year in September or October I get sick, and I get sick once a year, and it's always that exactly moment of the year. So I got used to this. Well, so let's not waste time and let's jump to today's topic. If you browse Facebook, Twitter, or any other social network website, you probably from time to time come across news that governments, politicians, or non-profit organizations come up with the proposal to ban the conversion therapy in a given region. And so far, conversion therapies are banned in Brazil, Germany, part of Canada, part of Spain, virtually banned in Switzerland, and illegal in some states in the United States. Professional psychiatric and psychological associations regard conversion therapies as pseudoscientific, unethical, harmful, and most of all, ineffective practice. And psychologists who try to anyhow change their patient's sexual orientation are usually disqualified from providing professional service and are widely criticized for their unprofessional and counter-scientific approach. And conversion therapies usually refer to several techniques, including counseling, visualizations, social training, and other, let's say, soft methods. And also, most commonplace form of healing people from homosexuality is group training, or maybe I should say social pressure stemming from the therapy group. And there are also more direct forms of therapy, for example, behavioral methods, including nausea-inducing drugs or application of electric shock to the hands or to the genitals. They were based or they are based on the behavioral therapy techniques, and the main idea is to present to a person so-called homosexual content, usually pornography, and applying punishment such as electric shock to cause the stimulus-reaction relationship, where that homosexual content and everything related to homosexuality is a stimulus and pain caused by an electric shock is a reaction. And people who believe in those reparative therapies are convinced that these techniques' effect remains infinitely, and a person's preference is going to change to heterosexuality. So they stop being gay and immediately become straight, and this is once and for all. The most recognized person within this field is ex-psychologist, and I'm saying ex because due to his unethical practice, he got kick off of psychological associations, and his name was Joseph Nicolosi. He was the founder of the National Association for Research and Therapy of Homosexuality, and he was also the author of the book entitled Reparative Therapy of Male Homosexuality, a New Clinical Approach. It was written, I believe, in 1991. I think so. And like everybody who believes in conversion therapy, Nicolosi also believed that homosexuality, or actually every identification other than heterosexuality, is a mental disorder. And being a mental disorder, it needs to be treated. The theory he conjured up says that homosexuality is a result of gender identity deficit, which is caused by rejection or perceived rejection or alienation from a parent during one's formative years. And when someone is not well identified with, for instance, a parent of the same gender, he or she cannot recognize the proper gender norms, what can interrupt a normal gender identification process. And that is how homosexuals are made. Nicolosi also wrote, and I believe he wrote it with his wife, the book entitled A Parent's Guide to Prevent Homosexuality. So you can see how they shape the view and people's perception of homosexuality. And according to Nicolosi and people similar to him, homosexuality is a punishment, disease, or disorder, something very abnormal, deeply wrong, and certainly something that needs to be addressed. And while, according to all the studies conducted in accordance with appropriate methodology, there is no evidence that homosexuality, bisexuality, or pansexuality, or any other sexuality at all can be regarded either as disordered or abnormal, and as such can never be the subject of the treatment that would lead to change it to heterosexuality. So that's the argument, saying that neither homosexuality nor bisexuality is a disorder, and consequently, if it's not a disorder, it can not and should never be treated. The other argument refers to efficiency of conversion or reparative therapy. I was speaking of behavioral methods earlier, so I'll start with those ones. In general, therapies based on behavior modification approach are widely recognized, efficient, and they are used by many clinical psychologists worldwide. For example, behavioral therapy is very effective in phobias treatment. When someone, for example, has a dread of dogs, behavioral therapy may include gradual approaching to the object. So first you look at the picture of a dog, and when it causes particular reactions such as fast heart beating or hand sweating and something like this, you learn how to relax and apply those relaxing techniques, and you repeat this sequence, picture, relaxations, a few times. And when you are okay with the picture of a dog, you can look at the picture, you feel alright, you can go one step further and watch, for example, a movie with a dog. And the film will possibly cause a reaction similar to these caused previously by the picture. So again, you experience fast heart beating, sweating, maybe handshaking. And again, you apply those relaxing techniques you're already familiar with. So we watch the movie, relax, watch the movie again, relax, and so on. And following each step, you can get closer to the dog, you can pet the dog, and finally you can play with the dog with no fear at all. So the behavioral techniques are in general very effective, but when used in an improper way, they can be harmful and painful. And when it comes to behavioral techniques used to treat homosexuality, such as electric shock applied after showing homosexual pornography, or giving someone nausea-inducing drugs after showing them picture of naked men, or forcing someone to masturbate after showing them films with heterosexual couple having sex, is first unethical, and second, in my opinion, it's revolving around sexual abuse, because when you go to a therapist, he or she can never force you to masturbate, especially in the company of other people. It is something unbelievable for us as professional counselors and therapists, and I would be under criminal investigation for something like this. So that's never gonna happen in the regular counselor's office. And finally, the only persistent effect it can evoke in a person is shame or guilt and the feeling of being humiliated, and there's no way to arise even the faintest chance to change sexual identity. And some may say, why would those methods be effective in one case and not in the other? Why can they be used in treating phobias and not in treating homosexuality? Well, not in changing sexual preference. The answer is quite simple. Phobias usually are not inherent feature of a person. And when this person shows up in a counselor's office, it is very likely that the phobias he or she experiences are distracting one's well-being and interrupting normal functioning. For example, this person cannot visit a friend who has a dog because she has dread of dogs, and this may affect her friendship. And according to DSM-5, Diagnostic and Statistical Manual of Mental Disorders, which is the classification used by mental health professionals to diagnose disorders, phobias can be classified as disorders, while sexual preference, like homosexuality, bisexuality, cannot be classified as a disorder. And so far, we know it from numerous studies. When people seek help and look for an opportunity to converse from homosexuality to heterosexuality, it always stems from social pressure and a will to be so-called normal, whatever that normal might mean. And since there's no place for sexual orientation in DSM or any other classification describing mental or physical disorders, there is also no place for treatment. Another argument used by those who defend conversion therapies is related to its efficiency. There are several autobiographies or confessions of ex-gays. Sometimes their confessions are used as a therapy method and called ex-gay ministry. But let's unpack this step by step. Meetings with ex-gay men, and I'm using examples with men because conversion therapies are usually directed to men, less frequently to women. And all those confessions which describe the process of healing from homosexuality are written by men. So women are not very visible, and it's because of many reasons. And one of them for sure is greater hostility toward male homosexuality in societies, and the research shows that the parents are less accepting toward gay sons when compared to gay daughters. But let's go back. The sense of ex-gays' testimonies is rooted in social psychology and takes the form of motivational speech and meeting with, a guy like me, the ex-gay, so someone who was gay some time ago and now is straight. So he's exactly the guy like me. The mechanism is very easy, since we know that people are more likely to believe or are more likely to trust someone who's perceived to be similar to them. And you imagine a young gay man who doesn't accept his sexuality, who thinks that being gay is the worst thing in the world, who feels ashamed and feels that he disappointed his parents and family. It is very easy to brainwash him. And the promise of changing him into being straight is very seducing. And using ex-gay as a role model, using him as someone like you who's overcame this, reinforces this trust even more. And one of the most famous ex-gay is Donnie McClurkin, the author of the book Eternal Victor, a gospel singer who's traveling around the US and sharing the story on how he became saved and healed. But the funny thing about this ex-gay movement is that there is also the ex-gay movement. Those are the people who for some time praised the reparative therapies and claimed that they helped many people, including them. But after some time, they confessed that they were lying, or at least admitted that the conversion therapies were not effective. For example, Patterson Toscano, who claimed that he stuck to the ex-gays movement due to his conservative Christian beliefs, and for a long time he believed that faith-based counseling programs would help him to alter his sexuality. It didn't. In 2007, Toscano found a non-profit organization for people who feel wounded and hurt by conversion therapies. And just like the another guy, John Smith, who led Love in Action in Memphis, and Love in Action was one of the ministry of ex-gays, and Smith admitted that he is still homosexual. He apologized for the harm he and his organization did, and he admitted that he has never seen anybody who successfully converted from homosexuality to heterosexuality. However, even though I'm absolutely certain that conversion therapies are harmful bullshit and they should be banned all over the world, I do believe that there are people who attended conversion therapies or sought help to change their sexual orientation, and now they are in heterosexual relationships. But it doesn't mean the change of their sexual preference was successful. It only means that they changed their behavior. And they could possibly do it all alone without any pseudoscientific procedures. But regardless, general scientific approach, I wanted to understand why people seek for such interventions and why, what is their opinion on this result. And since I was interested in more than just numbers and more than just statistical analysis, I was looking for a more qualitative approach. And I found a paper published over 15 years ago. So some may say that it's a little old, but I think it gives a nice picture of what people can get from conversion therapies and why they try to engage in those kind of therapies. The article was written by Backstead and Morrow, and they highlight that they both believe that conversion therapies are harmful and ineffective, but they are also open to meet a different approach and familiarize with people who see advantages over reparative therapies. Backstead, who declared a pro-gay perspective, alleviated this bias by interviewing participants who were non-LGBT identified, so those who underwent and who were proponents of conversion therapies. And Morrow described herself as a lesbian feminist with conservative Christian background who was not engaged in organized religious practice. And you may ask yourself a question, what it has to do with doing research? Well, we believe that the vast majority of research is objective. And when it comes to the quantitative research, where we use reliable measures, questionnaires, and scales, it is in most cases true. If someone doesn't mess with the numbers and analyze data in accordance with the proper methodology, it is objective and pretty reluctant to human bias. But when it comes to qualitative analysis, the type of research that includes interviews and interpretations, we have to be very careful and be aware that our perspective is influenced by our background, our political leanings, our experience, and so on. That's why it is necessary to clarify the research opinion in such papers. And in this particular piece, they analyzed 42 interviews with people identified as Mormons who were struggling with their sexual identity. And Mormons, of course, might not be the most representative sample from the general population, but in this case, it plays a significant role. If you look at all those organizations, they are concentrated on faith and God. And me, myself, I'm not a very religious person, to be honest, and I barely distinguish Judaism from Shintoism. So I'm not even going to pretend I know something more. But this is clear that people with very religious upbringing background have greater difficulties with accepting their non-heterosexual identification as compared to non-religious persons. And as far as I know, Mormons are very strict and conservative, so they might be a good example of people seeking reorientation therapies, though I'm aware that these examples might be a little exaggerated. But let's see what they found out about those people. They interviewed 42 people, 38 men and only 4 women, but again, it doesn't surprise us at all. Also, additional 8 people were interviewed later to provide their feedback on the preliminary results. And there's one thing that especially drew my attention. Participants were divided to opponents, those who underwent conversion therapies and are against them, and proponents, those who underwent them and still favor them. However, among the proponents group, there are only 2 people who identified as straight or exclusively heterosexual. Many people adopted self-labels such as heterosexual with a homosexual problem, or attracted to men but happy with the sexual behavior with wife, or a 90% heterosexual with homosexual past, and so on. So it kind of supports the hypothesis that conversion therapies might be successful in convincing people to behave in a different way, but not exactly changing their preference. And in addition, this change in behavior might not be a permanent state, of course. Backseat and Morrow depict an interesting pattern of how people are joining conversion therapies. Almost all participants described growing up in religious and homonegative environment in which same-sex attraction, as they called it, a gay lifestyle, was seen as unnatural, sinful, empty, and of course promiscuous. And participants also said that, quote, acting on homosexual feeling was incongruent with their heterosexual souls. And using the language of contemporary psychology, we would say they experienced internalized homophobia, which is the internal negative attitude toward oneself as a homosexual person, which stems from social norms and environment a person is living in. And that's the reason why people look for an opportunity to change their sexuality, because they perceive it as a choice between the homosexual lifestyle and acceptance of their family, friends, and the closest social group. And if you look at it, this choice seems to be one of the hardest we could ever imagine. That's why we shouldn't be surprised that people look for opportunity to change their preference to fit their environment, to be congruent with people's expectations. And some people also pointed out what buffering factors helped them while they were struggling with their sexuality. And they said that having supportive people, having someone who would listen and accept without judging or pressuring to change, so having a supportive friend and having LGBT positive role model were the most important buffering factors. And that last thing underlines how important it is to make LGBTQ people visible in media and in public space in general. And for those people who have it on a daily basis, and those people are kind of content blind. We don't appreciate rainbow flags on the buildings that much anymore. But for people who come from smaller town or got out of very conservative environment, this one rainbow flag might be the first sign that there is a place for someone like him or her in the world. That might be the first signal that there are other people like him or her in somewhere around. And some participants brought their diaries they wrote during therapy process to enrich the picture of their experience. And one of them wrote that the therapist told him to identify with same-sex peers, start taking chances, and develop new interests. So basically, be like them is what he told, using more complicated phrases. And other people described a mixed approach. The therapeutic approach was one of them, and it was sometimes combined with electroshock, chemical aversion treatment, hypnosis, hormonal treatment, visual imagery, marriage counseling, and similar things. And of course, the important part was support group facilitated by ex-gays or straight counselors. And one of the participants described it as follows. He wrote, "When you arrive for your first meeting, you would be asked by a group leader how serious you were about changing and how much you have read up on the subject. If they felt you were sincere, you would be allowed to attend the meeting. You enter the room with anywhere from 10 to 20 homosexual men. You would soon learn that you were not to use words like gay, fag, queer, homosexual. The preferred words were same-sex attraction. A lesson was taught on spirituality and a discussion about where and how you became homosexual and how wrong and evil it was to pursue those desires." And well, I can't even imagine how hard it must be for a young man who's looking for support, who's looking for help, and who must be listening to things like that. Quite unexpectedly, participants, even those who stood against conversion therapies, described positive experience related to them. They described the feeling of relief and the feeling of hope when they found out that help is available. And from the state of being alone and from having negative self-concept, they went to the state of having hope for treatment and congruence. And especially meeting those ex-gays who made it and speaking with therapists who are talking about their clients who are now happily married gave them hope and reassured that there is a chance to change. And both proponents and opponents, however, highlighted that after therapy, they felt more suicidal, felt that some or all aspects of the individual were destroyed. They also felt more confused. And some people also brought up incidents of their friends who committed suicide after going through therapy process. And we cannot be sure if those incidents were directly related to the conversion therapy itself, but definitely they left other participants numb and in doubt if they would be able to manage better. And those people got no help from those therapies at all. And, funny thing is that almost every participant agreed that the conversion therapies, no matter what approach was utilized, have not changed their core sexual arousal pattern. So translating it into normal language, they are still attracted to same-sex people. They are still sexually attracted to same-sex people, but some of them have built the relationship with other sex partners. So the core aim of the conversion therapy and the promise that it's going to change anybody's sexual preference fell flat. And when you go one level up and look at all those months or even years people spend on conversion therapies, it is just a waste of time, plus additional bonus, more self-negative concepts, greater internalized homophobia, shame, and feeling of failure. And still, many people, regardless if they were proponents or opponents of the conversion therapy, they require the real therapy. And by the real therapy, I mean the proper therapy focused on accepting one's sexuality and coming to terms with who the person is. And the key takeaway message from this research was that reparative therapy will not, contradictory to what it promised, set you free from homosexual arousal, and it will not make you heterosexual. It is not possible whatsoever. It's the situation parallel to this one. You tell me that you are attracted to tall women with brown eyes and black hair. And I, as a psychologist, I'm telling you, no, my friend, no. I'm gonna use several techniques and make you interested in old, gray, and short men. It's absurd. It is not gonna work. I can swear it's not gonna work. Whatever technique I would use, it's not gonna work. So, gathering it all together, conversion therapies, besides being ineffective and harmful, are just a waste of time and make no sense at all. They're based on pseudoscientific theories, mostly faith-focused, and they rely upon faith and Christian doctrine. And nowadays, all serious therapists, counselors, psychiatrists, and other mental health specialists work within the frameworks of acceptance toward non-heterosexual identities, and no other approach is accepted by mental health associations worldwide. Okay, so I guess that's it for today. Thank you for your time. Thanks for listening to this episode. Take care, and until next time, bye.